Good afternoon, everybody, and welcome to our April 7th virtual town hall to discuss COVID-19 in our area. If you are new to the broadcast, you are welcome to submit questions directly into the comment section or email us at chhw.questions@chhw.coos.or.us. We had a lot of questions from last week that didn't really get answered because of our technical difficulties, so we'll probably revisit some of those questions that got answered but didn't get heard, and we have got quite a few questions that we'll go over that we've received in the last week. Florence, do you want to say anything before we get started answering questions? Or?
I can say good evening, everybody. Thank you very much for joining us again for this conversation. We're very grateful for your questions that feeds our response. So thank you very much. What I can say very briefly is as of right now, there is still not a positive case of COVID-19 that we have identified. And that we are aware of a little over 300 tests as of a few hours ago that have been administered in the community.
All right. I'll just have you guys introduce yourselves so that people can get a gauge on what your voice sounds like.
This is a comment for Barb.
She's so good at signing.
This is Brian Leon, epidemiologist for public health.
Steve Takis, Coos Bay Fire Department Battalion Chief.
Florence Portal-Stevens, Public Health Director.
I'm Eric Gleason. I'm the PIO
Which stands for
Public Information Officer. And on the hands is Barb Young. Okay, so I'm going to go and hit some of the questions from last week because I know that there were some pretty good ones that nobody got to really truly hear. A lot of them, though, we did have quite a few questions about that 15-minute test. Is there?
you.
Yes, I am. A lot of the questions came last week had to do with that 15-minute test, and I know, Brian, you had a pretty good answer regarding those tests. Could we start off with one of those? Tom said, the government said that there's a test out now that only takes 15 minutes and thousands are being distributed today. When will the average person be tested?
Yeah, so those questions in regards to the rapid tests, there are a few different companies that are making them. It's important to distinguish the fact that those tests are not testing for the same thing as the PCR tests that have been being used pretty much exclusively for being a diagnostic result. The tests that are rapid are blood tests that are looking for specific antibodies that our body would produce in regards to an infection. And those you have to be a little bit more careful with in terms of just the timing, because it takes so long for those antibodies to be present consistently. It's a little bit more difficult to be really confident in a result for that kind of test, essentially. I'm sure they'll be looking at accuracy and checking some of those concerns against what our general need is for broader testing. But at least at this point, neither the CDC or OHA is considering those to be good for diagnostics. That doesn't mean that may not change in the future, or that test can't play a role that is different from diagnostics. that type of test can also be used to check potentially someone that's been sick to see if they've developed a strong immunity and could potentially rejoin the workforce. There are a number of different potential possibilities for a test like that. But even one of the manufacturers of these tests has even said in their press release that this is not a diagnostic tool. The testing that we've been using is polymerase chain reaction, which essentially just looks at the actual genetic material of the virus, not the antibody that our bodies make in response to it.
Thank you.
Yep.
We have a couple questions on the comments feed. We'll go to, one of the questions is there PPE available to workers working in congregate care, including Oregon Youth Authority and the Department of Human Services?
So we certainly wouldn't be able to speak to every facility or setting. My understanding is, as far as some of the feedback we've gotten from some of our local partners, is that there is at least some level of PPE that is available to them, depending on the circumstance, as far as whether it would be indicated to wear that gear. But I think the most important thing to understand is all of our partners locally, that includes state agencies, businesses, anybody involved in the response to COVID-19. They do know at this point where they need to reach out for us as a community to be able to try to coordinate where that equipment needs to go depending on need. So there is certainly a concern about the total inventory that we have available, but I think we're doing a really good job at trying to make sure that we're aware of where everybody is at and what their need is.
Another question from the comment feed. Melissa asked this question last week. She said she was tested for COVID-19 on the 30th of March. They used a throat swab, and she was told they were not as accurate. Can you tell her how accurate they are? The test did come back negative, but she's still not 100% well some days.
No, that's a really good question. And when we were talking a little bit ago about the validity and accuracy of the PCR test versus the rapid tests, we're not really entirely sure on all of the numbers. We do know that the oral pharyngeal test has at least some significant amount of lower accuracy than the nasal pharyngeal swab. We've talked a lot on this show about our desire to broaden testing. That is not just public health. That is any healthcare respondent in the area. We all wish we had broader tests. So I'm not sure the circumstance for Melissa's test. I do know that there was a chunk of time where oropharyngeal swabs were the only thing that was available to a couple of facilities. So that may have just been an issue of, hey, this is what we got, this is what we're going to use. But I do not have an exact number about the comparison between the two. I just know that nasal pharyngeal has been demonstrated to be more accurate.
Thank you, Brian.
Yep.
Follow up to Paul, the question earlier about the PPE. The same gentleman, Paul, said, where do we get masks? He works at Bologna Ranch. The OHA, DHS, and OYA have said that we can get it from Coos County Public Health. If we need it, we just need to mention congregate care.
Yes. So this is Florence Portal-Stevens. I'm the public health director. I'm just answering a question from Jeff about who is actually talking. So the person before me was Brian Leon, who is our epidemiologist at Coos County Public Health. Hopefully that clarifies. So to Paul, you can reach out to Philip now at Coos Health and Wellness in order to get you set up with some mask.
And that's why they can call the main line 541-266-6700 and ask for Philip.
Exactly.
Kelsey has a question. Some people who think this is blown out of proportion are saying that the tests are only for coronavirus in general versus for COVID-19 strain. Is that accurate?
No, that is not accurate. There are testing capabilities to test some of the previously discovered strains of coronavirus that range anywhere from SARS from back in the early 2000s to the coronavirus strains that are similar to just upper respiratory congestion that kind of seem just like a cold. There are a variety of tests out there that are specific to those strains. Again, the tests that we're using right now for COVID-19, those are tests that are looking at actual genetic material for this specific virus.
All right, thank you, Brian. We have two questions about getting tested. Sarah asked, how is our community deciding who is and who is not getting tested? And Bianca said, are healthcare providers in Coos Bay withholding from testing people without severe symptoms? So how are we deciding, or how are they deciding who is and who is not getting tested?
So currently, again, this is Brian Leon, epidemiologist at Coos Health and Wellness. Currently, there is testing criteria that has evolved over time based on capacity, based on what we understand about transmission. So this has kind of come up off and on over the course of the last couple of months, but I can tell you right based on testing capacity that is available, currently we are specifically targeting high-risk folks that have some of the underlying health conditions that are concerned, respiratory, chronic illness, cardiovascular disease, kidney disease. Of course, we've talked about those that are 60 and over. We've talked about individuals that are immunosuppressed. And then, of course, a lot of congregate care settings where the potential for transmission, regardless of who is involved, is quite high because of the close contact capabilities there. So that is certainly one part of who the state public health lab is prioritizing right now. And then, of course, you have those that are admitted to the hospital. You can understand the severity of those symptoms. Aside from those two categories, there certainly is still the potential that someone be tested. We're certainly going to look at any symptomatic individuals that were close contacts of a confirmed case. We're going to look really hard at a symptom profile of someone that has recently come from an area that has more endemic transmission. And we're, of course, going to potentially look at other possibilities too on a case-by-case basis based on medical history. I think right now the community, as far as healthcare providers and public health, we're really trying to have this balancing act where there's only so many tests, and we definitely want to try to catch as soon as possible the cases that lead to the most severe symptoms. So I hope everyone understands that this is not an issue of, well, we don't feel like testing someone, or they have mental symptoms, or they have symptoms that aren't going to put them in the hospital. We care about everybody here. We've done a lot to try to minimize the risk for transmission for everyone, but unfortunately testing capacity is not there for mild symptoms, no contact with a confirmed case, essentially the opposite of everything I just listed off. I know it's frustrating. Again, we've said several times, we would love to have broader testing capacity. I think it would be awesome if at one point, we could end up testing everybody for antibodies to see what's happened while we weren't able to test more creatively. But at this point, this is the situation we're in, and I'm sorry.
So I want to add on to this. First, to say we know there is community transmission throughout the United States, and definitely throughout Oregon. If you look at the latest map of cases that have been uncovered in the state of Oregon, Coos County within the 3 or 4 counties where we have not yet turned that zone. I just want to be very clear that not having positive test result does not mean that COVID-19 is not in our community. Just want to be very, very clear about this. And this is one of the reasons why you're all very well practicing social distancing, great hand washing, and that we found out very recently that asymptomatic folks, it's now pretty much confirmed that people who are asymptomatic can be, infectious and spreading COVID around. So this also is one of the reasons why there was some recommendation for folks to possibly, when they go in public, for their essential travels, that they wear a mask, and that could be a homemade mask, is absolutely fine. And the reason for that mask to be worn is not for the person to be protected. It is more so that the person who possibly is an asymptomatic carrier does not spread COVID-19 back out to the world. So, and to answer the question about the fact that there is some type of plan to not test people, we've been, I'm sorry, you feel this way. We've been working so hard since the end of January to make sure that our community is well prepared, well coordinated, and that we serve the public as much as best as we can. So please do not think this way. We're doing nothing to refrain from testing anyone. We're just following guidance.
Hold on. Stand by just a second. Can you hear me?
It's a little choppy. It's not as bad as last week.
I wonder if it's when we get too many people on.
It's not from the event.
No, we're streaming live off page. We're not doing the event. We're doing it just like we have been before. We're gonna try to keep. David James has a question that so many of us have. How long is this going to last?
Actually, one of our state, this is Brian again, one of our state epidemiologists today on a statewide call kind of addressed this thing. We would love to have a stronger answer at this point because of what we're seeing in transmission and difficulty with tracking down some of those connections and how very, very contagious this illness seems to be. I think part of the problem is that, even if cases with all of our efforts were to slow down to a drip, letting up those policies we have in place to protect everyone could easily mean that it will just kind of rage back stronger than ever if we do not continue to do what we're doing right now. So I know there are a couple of potential thresholds that they are looking at as far as.
Sorry, they're saying can't hear you.
Yeah.
They're saying they can't hear us.
I can hear you. Just has a tendency to chomp a little bit. Not like we did last week. Our internet's in good shape, and our dream rate is good. Using the speaker that we used the first 2 times.
Yeah.
in the same configuration that we had it the first 2 times.
Right.
The only difference is number of people. Both times we've had these, we've had people watching. We shouldn't have to be able to on Facebook.
Yeah.
So I was going to answer Jeff's question right now about county.
Sure.
So Jeff, Curry County has 3 cases, not 2.
Is that all of the answer? Okay. Daryl wanted to know if warm weather and sunshine would help kill the virus.
I'm not sure that there's any evidence at this point that there's a particular temperature, at least within normal living conditions, that is going to help us out there. I'm sorry.
It's getting worse. It's getting worse. Apparently.
Hang in
Sorry,
there,
guys. We're trying to fix this.
Every time you talk, it seems to come clear.
Maybe it's just me, man.
I wonder if it's the direction of that.
Yeah, come here.
Social distancing.
That's right. This is how we were last time. Yeah. So we're trying a different configuration, so so that Brian is maybe closer to the mic.
Is this better? Can people hear me? Better? Worse? Oh my goodness. I'm very sorry for all these technical difficulties.
Oh, Liz has a suggestion. If you click on setting and change to 240p, it is clear. Thank you very much, Liz.
Brian, you were just really clear on what you were saying.
Yeah?
So
Sweet.
maybe speak up a little.
Yeah, it says that it's better.
Okay.
It may just
All right.
be positional.
Yes.
Because Stephen said that he could hear me perfectly fine.
Okay. All right.
Let's
We
try
got this,
again.
you guys. We got this.
Where were we? Okay.
There was a
I
question.
have one here. We can go back up.
Yeah, go back up.
Oh my gosh.
Yeah. Oh, so we were talking about the warm weather.
Yeah,
So there was
warm
no evidence really about that.
Yeah, haven't heard anything about weather being a factor at this point, no.
And about the how long this would last. Wouldn't you say? I mean, I was thinking about this actually last night. This is just my personal opinion, okay? But you know, this is a novel virus, meaning that a lot of humans are not immune to it, and because of our, you know, connections globally, I would say I'm anticipating that this is gonna do the rounds for a little bit until we have a vaccine that can actually protect people and provide them with some.
Well, I know a lot of people have questions around that because you see different models that come out, right? In the paper, there was one, I think, online that came out today that says our peak will now be the 24th, I think, of this month versus the 6th of May. I mean, there's things that move, and I think people see all of these different numbers and they just hope to have some kind of answer. So, Bianca asks, a family member has underlying health conditions and had all symptoms except coughing and shortness of breath, age 67 with a compromised immune system, and was refused to test unless symptoms include both of those. If we waited until symptoms were severe, it could be too late. My answer from the clinic was that there is a shortage of tests, so I respectfully ask again, is every provider using the same questions and protocol to determine if testing should occur?
Hey, Bianca, this is such a great question because this is, as we mentioned before, the testing protocols have actually evolved, wouldn't you say, almost on a weekly basis, if not more often, Brian?
Yes.
And so depending on when, your family member had the encounter at the clinic, that could be one answer, right? That at the time there was possibly a need for all of the symptoms to be
Present.
in order for a test to be ordered.
I would also mention the fact when you say all the symptoms except for coughing and shortness of breath, understand that those two are two of the prime three symptoms that we are concerned about. Of course, there's quite a lot of things that can certainly cause a fever, and I definitely understand the vulnerability that you're talking about, but that is, some of the other symptoms that have been listed as far as potential symptoms for this disease. Those symptoms occur in less than half of cases. So just kind of something to give a little bit of context there to what you're saying.
And also, Bianca, just so you know, we are all working together to ensure that we serve our community in a uniform and standardized way at this time.
Okay, we have a question, I think, more towards Steve's direction. It's a two-parter. Cindy had asked, are there any essential workers being tested, hospital staff, ambulance, police, etc., to which Jeff replied that he had heard the Coos Bay Fire Department reported they were testing firefighters. Could you respond to that?
Yeah, so Coos Bay Fire Department, like most, if not all, first response agencies,